Good morning, Peter Goertz. I'm a psychiatrist. Should I take an SSRI? You may be asking yourself. For depression, anxiety, you may be desperate. Now, before you jump to an SSRI, it's good to realize there are other options, psychotherapy, things that address mindfulness like yoga, tai chi, meditation, changing your diet, acupuncture. Now, all those things aside from medication that I mentioned, take some work though. And some people prefer to just take a medicine. Now, we definitely don't want to shame people for doing that. So every person's different. If someone prefers to take medicine and not address things in psychotherapy, for example, that's totally fine. And that's their choice. And we want to respect that. The decision whether or not to take an SSRI can be confusing. Each person is quite different. Different people have different metabolisms, for instance, different genetics. And I've been prescribing SSRIs for decades, so I'm going to give you a feel for what my perspective is. Some studies have shown that SSRIs may not be more effective than placebo. So that's another aspect that can be confusing. However, in my experience, the SSRIs do help at times with some patients with anxiety, depression, OCD, even irritability. And of course, there can be side effects like nausea, tremor, sexual side effects that may persist actually even after the person stops the medicine. There can be emotional blunting. There can be hyponatremia, osteoporosis. The half-lives of the medicine, so the time it takes to get from a peak level to half that level in the blood, can be quite different from medicine to medicine. For example, Prozac has a half-life of 3 days, and the active metabolite of Prozac has a half-life of 7 days, so that's norfluoxetine. So the Prozac is pretty much like a depot medicine, and that can make tapering more easy, for instance, with the Prozac. Paxil and Zoloft have half-lives of about 24 hours. And the Paxil has no active metabolite. So that may be a reason why the Paxil can cause pretty significant withdrawal symptoms if it's stopped abruptly, whereas the Prozac, like I said, has a long-acting active metabolite and itself is long-acting, so it kind of tapers itself off. And the Zoloft has at least one active metabolite to my knowledge. The Paxil does not, so if you stop the Paxil abruptly, that can cause significant withdrawal symptoms. And I'll get to them in a little while. The Prozac can inhibit the enzyme P450-2D6 significantly. So the Prozac can markedly elevate levels of other medications, and that can be really significant medically also, physically. Paxil and Zoloft inhibit the P450-2D6 enzyme to a lesser extent, and the Lexapro tends to be free of drug interactions. Celexa can cause QTC prolongation, and pregnancy can be an issue. For example, Paxil can cause atrial septal defects in the fetus. The SSRIs need to be taken daily, and also they need some time to start working. So in general, a minimum of about 4 weeks is necessary to have a full effect of an SSRI. And there can be withdrawal symptoms if you stop the SSRIs, and that can be in the short term, but also in the long term for some people. And it can be confusing. Let's say someone stops taking their SSRI and then starts having withdrawal symptoms like dizziness, nausea, insomnia, feeling agitated, like you have the flu. Now, they may think, oh my God, that means I needed the SSRI. That may or may not be the case because those withdrawal symptoms can be just from the withdrawal, or if you start feeling depressed, that could be down the road. If you start feeling depressed, that could be because you did benefit from the SSRI. But just because you're having withdrawal symptoms after stopping an SSRI does not necessarily mean you needed the SSRI in the first place. Apparently, the nervous system gets very used to the SSRIs and changes. So if you stop the SSRI, the nervous system will need to change back, and that can take some time. And in general, we want to taper the SSRIs slowly, and that can be, for some people, very difficult and painful, especially if they've been taking, let's say, a high dose of an SSRI for some time. It can be quite difficult for them to get off of an SSRI. For other people, it does not cause any problem at all. So people vary quite a bit, and that's why the decision whether or not to take an SSRI in the first place can be quite difficult, because before you take the SSRI, you don't know which person you are going to be. If it's a person who can get off SSRIs very easily, or a person who, if you stop the SSRI, has major problems, or even has major problems trying to taper down the dose. Thank you.